Hello, this is Economics in Quarantine. And so far, we've been talking with economists about coronavirus and the economic response to coronavirus. Now, we're going to talk with somebody who's closer to the front lines of the evolving COVID-19 situation. We're talking today with Dr. Matthew DiPaola. Dr. Matthew DiPaola is an orthopedic surgeon in the Buffalo area. Thank you for taking the time in what must be a busy schedule, especially now, to talk with us. First of all, just a little bit about yourself. You're an orthopedic surgeon. You're in Niagara Falls, New York, I believe, the Buffalo area. First, could you tell us a little bit about your medical background, your practice, and how coronavirus has affected you professionally?
Sure. Yeah. Well, I practice in the Buffalo and Niagara Falls area. Specifically, as you mentioned, I am an orthopedic surgeon, so I do focus on treatment of musculoskeletal issues. I do have a specialization in shoulder and elbow surgery. The reality, though, is that in this crisis, all of us have reverted back to being more of a generalist type situation. In other words, they've pretty much shut down elective surgeries in the state and I believe across the country. I'm pretty sure that's happening up in Canada as well. And what that means is that a large portion of our practice are things having to do with treating musculoskeletal pain, such as rotator cuff problems, arthritis, things like that. Those are what we would consider elective. People can wait weeks to months, things like that. We still are continuing to do fractures, tumors, infections, things on more of an urgent and emergent basis. But it's changed in the sense that 2 weeks ago, we were running full tilt with full operating schedules and seeing patients in the clinic full time, which sometimes runs anywhere between 30 to 50 patients, depending on how busy your practice may be, to converting almost completely to telemedicine when we can. Some people we're bringing into the office, but we're trying to avoid it as much as humanly possible, simply to comply with the social distancing standards. Because we all recognize that as healthcare workers, we are what we would call super spreaders. So we are people who are in contact with tens, sometimes hundreds of people per day, often people who are sick and vulnerable. So we really have to be aggressive about doing our part to not only keep from spreading the disease, but to be a good example too. I mean, we don't want to make recommendations without demonstrating our own skin in the game, so to speak. We want to be able to show that we're practicing what we preach. So to get back to your point, we went from being all with normal full schedules, treating musculoskeletal problems, to having our practices totally upended. In fact, we canceled our first interview primarily because last week I was in the midst of tremendous amount of administrative turmoil. So while in one sense we shut a lot of things down and weren't as busy, on the other sense we were dealing with our own employees, their families, and a tremendous amount of uncertainty with our practices, how we were going to scale back, doing a lot of things with telemedicine, which we had not been doing before, calling our own patients, changing appointments, canceling surgery. So these are all things that we were dealing with, and hopefully now some of that has settled down, but we're moving into a new phase, and that is, how do we care for the people that still need care in person? Because that is still a percentage of what we do. You can't get away with it. There's just no way. I'll give you an example. While I'm trying to keep a lot of people out of the office, and the patients seem to be really responding well to the telemedicine, and it's actually fun in some ways because you can, people can save time both on our end and their end. You can't give injections over the telephone. You can't treat certain fractures over the telephone or over video. So we still do have to do in-person work, and the big concern is, are we protecting ourselves? Are we protecting our patients? So, we can get into some of the protocols that we're using to do that a little bit more if you want to. But yeah, these are all concerns, and we're moving sort of into a different phase of managing our practices now the way they are, also supporting our colleagues. I have to admit that I'm not, in the emergency room every day, but I have colleagues who are.
Mhm.
And I have colleagues who do anesthesia or who work in the ICU, and hats off to them, because they are the ones who are facing a lot more direct threat on a daily basis. But in some ways, we're all facing that, at one time or the other. So we definitely have different roles, and there's a lot of different perspectives in this.
Yeah, absolutely. And, the front lines are really challenged right now, especially due to the lack of PPE and so on. I'd like to get into that. I mean, throughout this talk, we're going to be talking about a few things. We'll talk about the front lines more specifically. We'll talk about whether people should wear a face mask in general. But right now, I'd like to focus on the front lines. According to guidelines put out by the New England Complex Systems Institute, which is a scientific body, during a pandemic situation, maximum PPE, which is personal protective equipment, must be given to frontline medical staff. You have mentioned previously that this is not necessarily being managed as well as it could be, and neither is testing, for that matter. Neither is mass testing. Why is this not happening, and are there any other steps that to help the medical profession during this crisis situation?
Yeah, I mean, this is something where I have to admit I've learned more about PPE in the last few weeks than I ever knew, and that I'm become very passionate about, primarily because we all have brothers, sisters, aunts, uncles, family, friends that are at risk. And so we look at each other as a brotherhood, sisterhood, and we really feel for our colleagues. So it's certainly something that is that I'm very passionate about, for sure. Why is it not being done? I think the answer is simple. It's scarcity. Where you can read between the lines and sometimes just read directly with what a lot of the authorities are saying. They're admitting that there's a lack of PPE. So whether you want to call it poor planning, or whether you want to just say, hey, this is completely out of the blue and no one could see it coming, that's something that's up for debate, I would think, and I'm sure people will be dissecting that for a long time. But I think the fact is that there's a shortage, and there's definitely a need to increase the supplies. I've seen a lot of great things being done in terms of people finding ways of getting PPE to the front lines. I've seen people starting GoFundMe pages, and I know personally some people who are at work trying to bring these things into the country and to get factories up and running and to retool supply. I mean, to give you an example, my mom and dad run an upholstery business. My mom has been sewing masks for the local hospital. People getting creative. So, I mean, it's been challenging, but also there's been some tremendous creativity that's come out of this. And personally, I've posted some YouTube videos on how to make masks, and with some materials that are readily available. To give you an example of something we've done in our practice, I contacted some tailors in the area, and they've converted some of their operations to making these masks and pumping them out. So there's been some really creative solutions, which I think have been wonderful for a number of reasons. Number one, just to help the people at the front lines, but number two, to prove that we can retool the human capital and skills that we have. I've joked with some people, I think I posted this online, that my mom taught my kids how to sew over the past year, and she bought them sewing machines because they really seemed to love it and took to it. And I joked that I didn't think sewing was going to be a survival skill, but
it is. It really is.
I think in this case you could say that, and it's really an interesting point, that because there's been a lot of talk about we've lost a lot of our manufacturing base in the U.S. and the globalization and things have gone overseas and things like that, and it's a really interesting example of how tangible skill with your hands, which I relate to because as a surgeon, that's what I do on a daily basis. I sew with my hands. Mm-hmm. But how that skill can become a survival skill, or how really truly important it is when crisis like this happens, that we have to get down and dirty and use our hands again. You know what I mean? So there's something I think really fundamental here going on. But to go back to the original question, I think, what has been driving some of the policy, I think a lot of it is scarcity. And the reality is it's led some of the leadership to drag their feet, perhaps. People have gotten, I think, really nitpicky about when you should wear a mask and which type and all that. And while certainly there is some good science about which type and which situations absolutely demand it, I think the science is much less clear about when, quote, everyone should be. And I think, you have to look at some constraints in terms of how good some of that research is.
Yeah, there was a news report that I saw, and I don't know if this is true, but in the United States, a nurse was essentially told by her supervisor that she could not wear the homemade mask that she had brought from home with her into the emergency room, even though she was dealing with coronavirus 19 cases. Now, regardless of whether or not that report is true, is there a regulatory constraint for healthcare workers in this domain? Like, if you do not have a standard issue N95 mask, this is not good, this is, against code or whatever. Is this something that you see as a particular constraint on the ability of healthcare workers to get PPE?
Well, I think what you're speaking to is what one of my friends, and I'll feel free to mention his name, Jaffer Ali. You've probably seen him on Twitter.
Absolutely.
Jaffer's a wonderful guy, and he's been kind of at the front lines of distributing some of these products and things. And what he pointed out to me was sort of a way of thinking about this that I had never thought about before, where he called it, there's 3 different times. There's conventional times, there's contingency times, and then there's crisis times. Mm-hmm. And the problem is that some people are not reacting like we're in crisis times. They're thinking either contingency, like, well, maybe we've got some time to kind of plan some things, or conventional. And the way decisions are made in those times are much, much different. And you can see this with how some of the regulatory bodies have acted. In fact, the CDC a few weeks ago loosened restrictions on what their recommendations were for PPE. They did, to their credit, recognize that there was a shortage. And so they said in shortages and when there are these unusual, rare circumstances like pandemic, that it may be absolutely necessary to improvise. Mm-hmm. So I think improvisation, they've at least come on record as endorsing that. And I'm not sure why some supervisors would clamp down on that. I don't know. I mean, I can't speak to their rationale. I mean, we could guess. I certainly am in favor of, if the workplace is not providing what you need, then to take every precaution necessary.
Absolutely.
I mean, to protect your own self and patients, for that matter. And thankfully, the CDC and other governing bodies have also endorsed that as well. So again, I don't know why some of the supervisors would. I've read some of the stories you've read, and some of them, it seems that they're concerned about patients getting scared or inciting alarm. And those types of articles were out there even more early on in this pandemic. In other words, people worried about, well, if you wear a mask, people might get scared. And I think now that things are much more prevalent, that's starting to fade a little bit. But then you ask yourself the question, what are we really worried about? Are we really worried about affecting people and harming people, or hurting people's feelings?
Absolutely, yeah.
I don't know. I'm not inside their heads, and I can't speak to their thought process. But I think it comes down to, when do you recognize you're truly in a crisis, and when do you start switching into a mode that respects that mentality? And when you're in crisis and resources are short-lived, you have to be willing to improvise. The example I used, and I actually use this as an example to convince my own practice to get ahead of this situation a little earlier than we otherwise would have, about wearing masks. And I use the example of, when you're in the Army and you're in war, sometimes your helmet has to double as a soup bowl.
Sure.
You don't have time for fine china. Mm-hmm. So you've got to do what you can to protect yourself. Now, a lot of the authorities have been making an argument, well, it doesn't really protect you. And I think now you're seeing this huge debate, especially on social media, about, well, we don't exactly agree. So there's people pointing out that the countries who full-time wear masks and that the equivalent of the head of the CDC in China agrees that people should wear them. So
could you speak to that a little bit? Because this is the $1 million question, I think, right? The public is being told by, for example, the Surgeon General of the United States, do not buy a mask, do not wear a mask.
Yeah.
And yet, on the other hand, if you have a modicum of ability to search for this information, you can go on PubMed and you can see information that masks do actually prevent viral spread. And even if you don't believe that that's the case, even if you believe that they only help those who are infective, this is an asymptomatic virus in certain stages, right? So it still makes sense to wear a mask by that logic. How would you break this down? Why is there should the listeners wear a mask? Should everybody wear a mask?
First of all, I'll give my endorsement. I would advocate doing it, okay? And I'll explain why. I think it's a very complicated problem. I really do. But your answer has to be simple. So even though the issue is complicated and the uncertainty around it is complicated, in the end, it comes down to a yes or no question. Yeah. All right. And so the yes or no is, do I improve both my risk and risk to society as a whole by doing it? And from everything I've looked at, I think the answer is yes. And the downside of it is very low. Now, I can understand why authorities are trying to limit sort of a panic or a scare to get them, because they are trying to save it for the front lines. I can see where they're coming from, but I think, again, they're thinking in conventional times. In conventional times, it's, well, we have a static supply of X type of surgical mask and X type of N95 mask, and therefore, since it's static, we have to reserve them for the people in front. What strikes me is that, number one, they have a lot more experience with pandemic than we do. So if we're just looking to the experts who are experts, what about their experts? I mean, why are we not taking into account their experience? There's a beautiful graph showing that the countries who do this on a regular basis have truly bent their curve, whereas the ones who don't, like our country and Europe, have not. And those are basically huge population studies. Now, you have to admit that this is a tough question to study as a purely scientific question. But there's two big problems. One, you don't have time to do a big randomized study, number one. Number two, that kind of study is extraordinarily hard to do because there's so many confounding factors. And you have to often use proxies like other types of influenza or the previous version of SARS or H1N1 to help you glean some knowledge about the particular problem. But in my research, there was a Cochrane review that looked at this. There was some notable protective effect on a population level. And again, move on, people, you're not listening to the science. But science is a process.
Mm-hmm. Yes.
Science is a way of asking a question and testing that question, and it is intimately wrapped up in statistics. And you have to recognize all the weaknesses of the particular studies that are out there and the possibilities of what you can actually study well. So if you just look at what's out there, you'll find that there is some supporting evidence and that there's some things that have been changing pretty quickly. I just looked at a study yesterday that was from 2018 that showed that virus particles can stay aerosolized much further distance from people than we think and for much longer than we think.
That's scary.
Yeah, and I looked at another one that showed that there were virus particles discovered in the bathrooms of the COVID patients, in the air ducts of the COVID patients. So being that we don't know exactly how many virus particles it takes to infect any one person, and that we have to assume that people can be shedding this and that there are a number of asymptomatic carriers, to me, it just speaks to using what our friend Taleb talks about, the precautionary principle.
Yeah.
If we have a ton of potential uncertainty in a situation, and the risks from using some kind of intervention like a mask are relatively low, which I really feel they are. And you can argue that Some people might use a mask wrong, but I see a lot of people walking around and they seem to be doing an okay job of putting a mask. But as long as the risk of using it is low and we have good availability, which I would argue we do from an improvisational standpoint, then I see the harm of using it as being minimal and the benefit being potentially high. So that's my thought process on it. You know, too hung up on the science that's out there when, number one, the science isn't great because you can't do large-scale randomized trials in pandemics.
No.
And when there's a tremendous amount of uncertainty. I mean, that's the bottom line. Look at the actual study you would have to do to prove your hypothesis correctly. And has that study been done? Is it even doable? And if not, what do we do in light of that? So again, I think they're speaking to, they're letting the scarcity and conventional thinking drive things too much. But thankfully, we have YouTube now, and that you can point out and say, we can be creative. Let's be creative. You know what I mean? Let's be creative. So
absolutely, you know, this flaw, I guess, in the statistical reasoning of the authorities, and even I have to say among scientists, like you might have read this article by John Ioannidis, and there was another article by these two Stanford professors, which absolutely I thought it just committed elementary statistical errors. I'm going to be quite honest with my listeners. Among people who are supposed to be experts in this field, among health professionals even, there is a alarming lack of statistical awareness that has manifested in this crisis, particularly when it comes to things like the precautionary principle. Ioannidis, for example, suggests that we need more data before we make decisions. But as Taleb says, you know, when you have an avalanche coming, you don't wait to pull out your calculator and make a bunch of calculations, right? Well, what can be done just from an institutional level to correct this flaw in the statistical reasoning, the statistical approach that the authorities, that the experts are taking?
Yeah, it's a hard question because, again, I think it comes back to recognizing the impact of the event. If the impact is extraordinary, and if the speed at which that impact comes upon you, like an avalanche, is extraordinary, then that speaks to the amount of time you have to make a decision and the reality of the fact that you have to actually act, because not acting is an action in and of itself and could cost thousands and hundred thousands of lives. So that point is the point that has to be emphasized, that sometimes it's okay to wait for data. There's times where that's okay, but there's other times where it's not. It's
Absolutely,
just not okay. You can't wait. You can't, decide to buckle your seatbelt at the last minute before the car crash. The car's coming in 1.2 seconds. It's about to hit me, and then buckle. You can't do that. It doesn't work.
Oh.
And it's funny because, this whole, I've been at home more recently and with my kids, and, we've been doing some homeschool stuff, and it's a lot of fun. And I was helping my one son out the other day and finding a book for him on my bookshelf. And I found the book that I don't think I ever read the whole thing. I think I read parts of it or most of it, The Plague by Albert Camus. So it's a famous book, and he won the Nobel Prize in Literature. But I just picked it up and started reading random pages from where I'd left off and found a quote to that effect, that it doesn't matter at this stage right now, all the itty-bitty details and nuances. What matters is time, and we don't have a lot of time. And unless you recognize that situation that you're in it and recognize that you don't have a lot of time, you'll continue to live in those conventional ways of thinking. There's conventional time where you have time to work. Let's give an example. In my world, arthritis. So when people have arthritis for 5-10 years and they're thinking about getting a joint replacement of some sort, a knee replacement or hip replacement, or in my case, a shoulder replacement, you've got time to think. You've got time to think, what implant's the right implant? What operation is the right operation for me? What's the correct therapy to do after? You can delve through literature and you can, find the best studies and design one that's not there and that kind of thing. Because you've been living with it for a long time. When the pandemic hits, just look at what's happened in a few weeks. We're seeing doubling of all these different events happening in such short spans of time. that if you waste that time not doing an intervention that may actually help slow it, then you're just giving up huge amounts of advantage that you have in beating this problem.
Yeah, this is an issue, I think, in which a little education, I can't remember who said it. It might have been Mark Twain. He said something to the effect that a little education is a dangerous thing, right? So you find among members of the general public who maybe don't have a background in statistics that they are much more familiar with this precautionary principle. Just from your perspective, for members of the public, I know we've had this problem in my own country, in Canada, in which, just 2-3 weeks ago, people were going about as if nothing was going on. There were very few cases, very few confirmed cases in Canada just a few weeks ago, or even a month ago. Everybody was going about as if everything was okay. Nobody was wearing a mask. Nobody really cared. No social distancing was going on. And I think a lot of the problem here is, quite frankly, the fact that we are given a deluge of media about this virus, and we don't know, as the public, how to sort the good information from the bad information. So what would be some heuristic advice just for listeners, because most of us are not trained in the scientific method? What would be some good heuristic advice for listeners in terms of how you sort through different articles and sort through different types of information when approaching something like coronavirus?
That's a good question, because I think it speaks to a bigger problem just in modern life, that we're inundated with noise. I mean, regardless of whether it's coronavirus or anything else, it seems to be a sign of our times that you need really good filtering mechanisms to figure out what is worth listening to and what is not. I think everybody has to have their own. And it's tough in this situation because there aren't a lot of people who have experience with this particular problem, at least on this side of the globe. So one way certainly is to look at where it was coming from and look at the Italian experience and the Chinese experience. Now, you can argue that perhaps the Chinese weren't as forthcoming in the beginning, but there certainly was a lot of media once it started kicking into full gear. And if you just start extrapolating that a virus, everybody uses the term going viral, so we all know what that means.
Sure.
It means it blows up really fast. So if you could just use your own logic and realize that what happened there could happen here, and then watch how it was unfolding, you could do a lot of prediction in your own mind in terms of what we're going to be seeing, but also what we're going to need to do. I can say that the medical community, some are good and some are bad in terms of understanding more the system aspect or how fast these things get on top of us. I can tell you now everybody fully understands, but I couldn't say that 3 weeks ago, just because there are a lot of people who still, may have thought, well, it's like the flu. But you can definitely, as a heuristic now, trust those people who are on the front lines. I follow a couple people who are intensive care specialists to see what they're doing to treat this. And there's some very smart people and great people who are, figuring out the symptoms and what the correct treatments are and who's using different types of medications and things like that. So those are very good sources right now in the thick of it. The people, I just sort of lucked out and happened to be a follower of some of the people who tend to understand these processes well prior, in other words, the people who are pandemic experts, so to speak. But yeah, the heuristic I would use is look where it's happened already and trust that their experience is going to show you something. Again, to me, I don't quite understand. Our CDC or our Surgeon General is not looking to some of that Chinese experience. I mean, one of us who's been around the world a little bit, and I'm not a huge world traveler, but I've traveled a little bit, will notice that folks from the East Asian countries have no reticence about wearing a mask on an airplane or on
Very
a plane.
true.
They just don't.
Very true.
And I don't know whether it's just, some of the countries have pollution issues and things like that, but my gut after all of this tells me that it's because they've faced H1N1, SARS, and those types of things over the last 10, 15 years. They've faced a few of them. So who are you going to trust more? The people who've faced this already and just do this as a habit, or people who've never seen it? I mean, the reality is, in this side of the globe, we've never seen something like this. And so you have to couch everything you are seeing and hearing in that perspective, that we are really naive to it. And in the beginning, they may have called you a Chicken Little, but the reality is, taken in that context, most of us would really not have our antenna up for something like that. Mm-hmm. So those are some of the things that have guided me, and I don't know if that's a help to you or people, but that's some of my thought process on it.
I think that's great. I mean, as I think it was said, it's better to panic early and not have to panic later, because if you panic later, you have these problems like rushing to supermarket shelves and so on. I'd like to just sort of shift gears to something a bit lighter than the coronavirus situation. And I'd like to ask, I know your background is in medicine. You went to Cornell, I believe, for your medical degree and your undergrad. Correct me if I'm wrong. And Cornell is a fantastic medical school from the reports I've heard. For those of my viewers who may be considering medical school or a career in medicine, what would you advise in terms of specific advice before they even apply, or before they even, seriously look into different schools?
I guess first do some soul searching, just figure out that is your calling. I think what got me into it was I had an attraction to surgery in general. I just knew that was an appealing field for me because I felt like it combined so many different fields. I'm not sure how to put it, but combined so many different types of skills. You had to know how to work with people. You had to like to delve into the science. You got to be a craftsman, so to speak, by working with your hands. There's great teamwork in the surgery. There's a tremendous ability to help solve problems on a daily basis and to do a lot of different things. It will always keep you interested because you're always going to come up with new problems to solve in new and inventive ways. So all of those things, I felt like I didn't know an area, a career that would combine all of those. And there's also very much a component of ethics, of an ability to make good decisions with other people in mind, and doing the right thing, so to speak. Where you can take your skills and put it immediately to that use on a daily basis. So those were the things that drew me. There's going to be things that will draw other people. There's going to be reasons. I have colleagues who are all over the map, and it's a wonderful field in that way because we have fields within the field that are as different from each other as medicine is from law or medicine is from business, which is amazing. It blows my mind every day. I've got friends who went into pathology and who never see a live patient. I've got friends who went into pediatrics who only see children, and some who never wanted to touch a scalpel nor never should be allowed to touch a scalpel. But anyway, you have to decide. My word of advice is first and foremost decide why it is you're doing it.
Okay.
Because if you know that in your heart, then regardless of the hurdles, you'll be able to dig deep and figure out a way to make it work for you, whether it's at some, upper tier place or some other place. Once you get there, the chances of you finishing are extraordinarily high. It's a field unlike some where the dropout rate, say for law school or business school, is much higher compared to medical school. Usually once you get there, you're motivated enough to complete it. So first figure out your motivation. Figure out your motivation. Figure out why you want to do it. Are you willing to sacrifice for a long time? Because it's not going to be something where you're going to jump into and then the next day you're going to be an expert. In fact, I remember thinking to myself when I finished medical school, well, now I've got to do the real apprenticeship, which is for us the residency, and involves some, long hours. But it's it's interesting now. You're seeing people come around. You see this now on the internet a lot, that people are recognizing the value in the apprenticeship model. And I think medicine has always had that, and
Yeah.
will continue to, because I don't know any other way to do it besides that.
Basically, having a compelling, I suppose, reason within you that you should do this. This is something
Yeah.
that you have to feel is your calling. And I guess before you even enter at medical school, how would you really do that? Would you like go to a hospital and maybe try to shadow a physician, or how would someone go about that? How would they...
I don't know.
Yeah.
I mean, there's that element for sure. I don't know that you'll ever totally understand it until you're in it. And I didn't realize this until I was in school, but because I don't have family members that are doctors. So my brother and I've got a twin brother, identical twin brother. I don't know if you've seen him online too,
Yes.
but we
Yeah.
banter back and forth a little bit. But we both decided that we wanted to be surgeons, and both of us were the first ones in our family, as far as we know. We used to joke that my grandfather was a truck driver with a 7th grade education, and he used to patch everybody up in the neighborhood when they would get, they'd cut their head open playing street hockey or something.
Wow.
He'd bandage them up, and everybody joked that they'd take them to Uncle Sal's, and he'd take care of them. And my dad sort of would do the same things. Like one time I got a fish hook stuck in my finger, and my mom, I was probably 6, 7 years old. My mom said, "Oh, we got to take him to the hospital." And my dad said, "Don't worry, we'll take care of it here." And, he told me to bite on a rag and pull it out in the kitchen. So while we have some tradition of that in the family, my brother and I are the only ones that are formally trained in medicine. So, I guess getting back to it, what I meant by that is that I had a lot of colleagues when I was in medical school. I was surprised with how many of them had parents or other relatives who were doctors. And I didn't know how to understand that in the beginning. I thought, well, are they just doing it because their parents did it? But now, being in it, I think I can really understand why, if they followed their parents, why it's valuable, because you learn all the ins and outs. Not just that there's much more to it than just, oh, you got to like biology and you have to like, biochemistry, things like that. It's not that. It's the decision making, the lifestyle, the stories you bring home, and how you approach the marathon of it. How do you approach it from sort of a process standpoint that this is going to be the next, decades of your life in terms of the training and that kind of thing. So I appreciate that much more now than I did before, because I didn't have that experience. So a lot of it was just a gut instinct. It was a gut instinct for me, really, in terms of I felt like there were enough elements in the profession that I could dig my teeth into, and ultimately, I've been happy with that, and feel like I'll tell you the other reason that I specifically medicine appealed to me was I remember having an experience in high school where I don't remember the exact thing, but something that I'm trying to think what it was. I remember there was an element of something in sports, I think, where somebody had more control over the situation than I did. Where it was just based on some coach's discretion or something or other like that. And I thought to myself, being a doctor, once I'm gathered that skill, nobody will be able to take that away from me. So the idea of having a skill, a talent that no one can take away from you, and that you could take around the world, whether it's in some third world country and they're paying you in chickens, you still have some skill that no one can ever take away from you, and it does not depend on a popularity contest in any way.
Absolutely, yeah.
To me, was a tremendously empowering thought, and I still hang my hat on that today. And I have to tell you that I feel like medicine gets more rewarding as you go, primarily because of that feeling that you feel more confident in your skills, and that when someone shows up to your door, your ability to know whether you can help them or not, and sometimes you can't, but at least get them into someone else who can. But the confidence, because the confidence in your own skills grows, and it's a very it's a wonderful thing, in that sense. So yeah, you've got to think about it that way. I mean, those are the ways I thought about it, but everybody's going to be different. Yeah, and there's going to be some people who are going to think about it in different ways. And I'm not saying my way is the right way, because everyone's got their own motivations. And we had the beautiful thing about the places I've been and seen, I've seen lots of different motivations and lots of different, I'm always impressed with the people I work with where they come from. I mean, we had people who were so talented in so many different ways that you never expect, like people who were wonderful violin players or had totally different careers before coming to medicine. I mean, one of my classmates was a New York City police officer for 9 years before coming to school, and other ones had various degrees before that or jobs prior to. Some were teachers before coming. So just there's people who come from all different walks of life and come at it from different angles. Like they were engineers but decided, nah, you know what, I really like the frontline aspect of it, and then they diverted. So there's so many different ways of coming at it, which is, it's neat.
Yeah, I think, these kinds of questions, the main issue with them is that ultimately it's a gut feeling that leads you to choose a particular career path rather than any kind of purely logical way of going about it, right? As you say, there has to be a calling. So with that being the case, where can we find you, Matthew? Final question: where can we find you? Do you have a Twitter? Do you have a YouTube? What are these? And if you do, then I will put them in the description.
Yeah, sure. The Twitter is DiPaola MD, or at DiPaola MD, I guess. So you'll put it in there. I have not been super active on YouTube, but maybe at some point I'll get some videos. I might have some more time with downtime from surgery. Sure. To get on YouTube more. I think the video thing is probably fun and a good venue because as you can tell, I do enjoy talking a little bit. So, but Twitter I do like Twitter. That's probably my favorite social media.
Yeah.
I have a Facebook account, but I don't really use it a heck of a lot except once in a blue moon. So Twitter is really the place. I do have my own website for my practice, which is drmatthewdipaola.com. That's primarily for patients with shoulder problems who are interested in reaching out, and the site is undergoing a little bit of a remodeling, so you'll see a new version of it pretty soon. But I only use that for people who have shoulder pain and elbow pain and things like that who want to get in touch with me. But if there's people out there who do, more than happy. I've actually had a couple of people from Canada reach out and find me through there. Occasionally we get some people come across the border, which I always welcome them. So.
Yeah, and I can see your Twitter is fantastic. Full disclosure to everybody, that's how I found you. I found your Twitter feed very interesting and very enlightening. So
yeah, I want to say thank you, by the way, for reaching out, because I found the reason I like Twitter is for this reason exactly, is that we never would have met otherwise.
No.
And you've been fantastic and seem like a wonderful guy. And now
thank you.
We've gotten a chance to make new friends. And
absolutely. Yeah,
it's a beautiful thing, really. So, and I think people realize that, and it's amazing. It's amazing. There's a tremendous group of people around the world that are connecting and helping each other, and we're gonna have friendships going forward, and it's a great thing.
Yeah, I think it's a great thing that we're able to do this, and especially now in the midst of a pandemic, it's good to have that information communicated. So, thank you. Dr. DiPaola, for reaching out, and thank you for making the time for us amidst your busy schedule. Just to let my listeners know, next week we will be talking with a Saskatoon surgeon on his perspective from the Canadian side of the ongoing coronavirus situation. And next week we will also be talking to an Indian economist about what she is seeing from India. So once again, I'd like to really thank you, Matthew, for making the time for us.
Thank you so much. It's been absolutely my pleasure.
Cheers.